Our emotional and physical health, as well as other elements of our well-being, can be significantly impacted by low dopamine, a neurotransmitter in the brain. Dopamine is a key regulator of reward, pleasure, movement, and motivational pathways. Low dopamine levels can cause a variety of symptoms and aid in the emergence of a number of illnesses. We shall thoroughly examine the causes and signs of low dopamine in this article. Low dopamine causes Parkinson's disease, multiple system atrophy, and progressive supranuclear palsy are a few examples of neurodegenerative disorders that can cause the gradual death of dopamine-producing neurons in the brain, lowering dopamine levels. Drug and substance abuse. Long-term cocaine, amphetamine, and opioid use can interfere with the normal operation of dopamine pathways, resulting in a reduction in dopamine release and synthesis. Medication. Some psychiatric drugs, like antipsychotics, can block dopamine receptors or decrease dopamine synthesis, which lowers levels of the neurotransmitter. Chronic stress and weariness can prevent dopamine from being produced and released, which results in a drop in dopamine levels. Genetic variations. Some people may have genetic variations that impair the activity of genes associated to dopamine, resulting in decreased amounts of dopamine. Nutritional deficiencies. Low levels of dopamine can be caused by inadequate intake of important nutrients such as iron, folate, vitamin B6, and vitamin D. Age. Dopamine levels may decrease as a result of a natural fall in dopamine production that occurs as people age. Dopamine low symptoms. Depression. Low dopamine levels are frequently linked to the signs and symptoms of depression, which include ongoing melancholy, lack of drive, loss of interest in hobbies, and a sense of hopelessness. Low dopamine levels can interfere with sleep cycles, making it harder to fall asleep, stay asleep, or cause restless and shattered sleep. Dopamine is a neurotransmitter that is involved in cognitive functions like memory, attention, and problem solving. Low dopamine levels have been linked to cognitive dysfunction, including problems with memory recall and concentration. Motor symptoms. When dopamine-producing neurons are harmed in disorders like Parkinson's disease, motor symptoms like tremors, muscle stiffness, slowness of movement, and coordination issues can manifest. Low levels of dopamine can enhance drug cravings, which increases the chance of developing addicted behaviors. Low dopamine levels have been linked to restless leg syndrome, which is characterized by an uncontrollable urge to move the legs and is frequently accompanied by pain or discomfort. Dopamine regulates sexual desire and pleasure, which can lead to decreased libido. Sexual dysfunction and a decline in desire can be caused by low dopamine levels. Dopamine deficiency can cause people to lose their motivation, show less initiative, and lack the drive to complete tasks or reach their goals. In conclusion, there are numerous factors that might contribute to decreased dopamine levels, including aging, genetics, neurodegenerative diseases, substance addiction, medications, chronic stress, and dietary inadequacies. Depression, restless legs syndrome, and Parkinson's disease have all been linked to low levels of dopamine. Dopamine deficiency can cause a variety of symptoms, including fatigue, moodiness, and lack of motivation. Many medical disorders connected to low dopamine levels have treatments available. Dopamine deficiency. What is it? Both a neurotransmitter and a hormone, dopamine. It transmits chemical signals between brain nerve cells or between the brain and the rest of the body. It is crucial for numerous bodily processes, including memory, drive, education, reward, and mobility. Low dopamine levels are referred to as dopamine deficit. Depression and Parkinson's disease are two illnesses associated with low dopamine levels. You can become more prone to taking chances or developing addictions as a result. What causes low amounts of dopamine? The neurotransmitter, dopamine, is produced in specific regions of the brain. If the parts of your brain that produce dopamine are damaged, you could have low levels of the chemical. If your body doesn't react to dopamine properly, if there's an issue with the nerve cell receptors that take in and transmit the chemical message, you can also have low levels of dopamine. Dopamine insufficiency is related to some medical disorders. For instance, dopamine and nerve cells are lost in certain regions of the brain in persons with Parkinson's disease. Additionally, due to damaged dopamine receptors in their brains and diminished dopamine release, cocaine addicts need increasing amounts of the drug to obtain the desired effects. What signs or symptoms point to a dopamine shortage? Low dopamine levels can cause the following symptoms. You lack the drive or motivation. You're worn out. You are unable to focus. You're irritable or worried. The pleasure you formerly felt from enjoyable encounters is no longer felt. You're feeling down and hopeless. Your sex drive is low. You have a hard time falling asleep or sleep poorly. Additional indications of decreased dopamine levels consist of Parkinson's disease symptoms include hand tremors or other tremors at rest, loss of coordination or balance, increased limb, muscle stiffness, and cramping. Leg trembling syndrome. Short-term memory issues, difficulty handling daily chores, and having trouble coming up with easy solutions, all signs of cognitive changes. Attention deficit hyperactivity disorder symptoms include issues with aggression, low self-esteem, anxiety, forgetfulness, impulsivity, and a lack of organizational skills. Negative symptoms of schizophrenia include social isolation, diminished feeling, and lack of pleasure. Dopamine insufficiency manifests itself in a variety of ways. Depending on your underlying cause, what you might go through. Your symptoms, for instance, would be very different if your low dopamine level was linked to schizophrenia than if it was linked to Parkinson's disease. How is a lack of dopamine identified? Lack of dopamine is not a recognized medical condition. Dopamine levels are rarely assessed by medical professionals. Even a blood test by itself doesn't reveal much valuable information. A blood test, for instance, can assess dopamine levels but not how your brain reacts to dopamine. Instead, they will ask you about your symptoms, your medical history, your lifestyle, including alcohol and drug use, an examination, and any tests that could be required in light of those symptoms. Your healthcare professional will decide if you have a medical condition associated with a low dopamine level using this information along with the results of your testing. A dopamine transporter test may be prescribed if your doctor suspects you have Parkinson's disease. Using single-photon emission computed tomography, SPECT, a radioactive substance, similar to a dye, is injected into your circulation for this imaging test. Parkinson's disease causes damaged nerve cells and dopamine loss in the parts of your brain that are affected, which results in a clear pattern that can be seen on the scan. How are diseases associated with a lack of dopamine treated? The underlying cause of dopamine insufficiency must be addressed before treating it. Parkinson's condition. Parkinson's disease patients may receive levodopa prescriptions. Dopamine agonists like pramipexole, Mirapex, ropinirole, Requip, or rotigotine, Nupro, may be administered in some circumstances. Dopamine agonists function by imitating dopamine and inducing the same response in nerve cells as dopamine does. Leg trembling syndrome. The dopamine agonists pramipexole, Mirapex, ropinirole, Requip, or rotigotine, Nupro, are also used to treat this problem. Depression. Selective serotonin uptake inhibitors, such as fluoxetine, Prozac, that influence both the neurotransmitters serotonin and dopamine to make them act, may be used to treat depression. ADHD refers to attention deficit hyperactivity disorder. Methylphenidate, Concerta, Ritalin, which raises dopamine activity, can be used to treat this disease. How can I naturally raise my dopamine levels? Consult your healthcare physician if you believe your dopamine levels to be low. It's possible that you have an illness that can be treated that is linked to dopamine insufficiency. If a disease cannot be identified, you might want to attempt treatments that boost dopamine naturally. Remember that more study is required to determine how diet affects neurotransmitters like dopamine. Eat a diet rich in tyrosine-containing foods and magnesium. These serve as the building elements for the synthesis of dopamine. The amino acid tyrosine is. It enters your body, where it is absorbed, and travels to your brain, where it is changed into dopamine. Chicken, almonds, apples, avocados, bananas, beets, chocolate, green leafy vegetables, green tea, lima beans, oatmeal, oranges, peas, sesame and pumpkin seeds, tomatoes, turmeric, watermelon, and wheat germ are among the foods known to enhance dopamine. Take part in activities that provide you joy or relaxation. Dopamine levels are thought to rise as a result. Exercise, mindfulness practices, yoga, massages, pet playtime, nature walks, and reading books are a few examples. Which supplements increase levels of dopamine? Among the supplements that raise dopamine levels are tyrosine. A natural amino acid called tyrosine serves as a dopamine precursor. Tyrosine is used to make dopamine. L-theanine. Another dopamine precursor is L-theanine. B5, B6, and vitamin D to produce dopamine. These vitamins are required. Essential omega-3 fatty acids. Magnesium. What further information do I require regarding dopamine deficiency? It is impossible to analyze low dopamine levels in a black and white manner. It's a challenging topic. It's crucial to understand that medical issues are not brought on by low dopamine levels. Although there is a connection or relationship, low levels do not directly cause the illnesses. The ideas of correlation and causation are even more opaque. For instance, obesity is associated with reduced dopamine levels. It is well established that diet and exercise have an impact on how your brain processes dopamine. The question is whether eating poorly, items that don't increase dopamine levels, and lacking the drive to exercise result in low dopamine levels, or whether low dopamine levels in the brain set off the reward system that makes eating poorly and not exercising more pleasurable. And last, no neurotransmitter functions independently of the others. Serotonin and dopamine, for instance, interact frequently. As previously mentioned, understanding neurotransmitters is a difficult topic. Cleveland Clinic's statement: your physical and mental health may suffer if you don't get enough dopamine. Parkinson's disease, restless legs syndrome, depression, schizophrenia, and attention deficit hyperactivity disorder, ADHD, are just a few of the illnesses that have been related to low levels of dopamine. To manage these issues, there are treatments available. Other approaches to increasing low dopamine levels may be taken into consideration. However, consult your healthcare physician first. Together, you and your healthcare professional will determine the best method for treating your dopamine deficit.